What's up, everybody? Welcome to the first video in a series of videos that I'm trying to do about pharm and drugs. And so these videos are intended for AUC students who are embarking on their medical school studies. So the first thing that we're going to do is thiazides, and I'm pretty much trying to keep these clips short so that you can just watch them and get them over with, and you can go to each drug or watch them in a big playlist or something like that. So we're just gonna jump right into it. So first drug that we're gonna talk about is thiazides, okay? And just for a little background, thiazides are diuretics, and they are used for hypertension, okay? And so whenever we're talking about drugs, we need to understand two things. And the two things that we always need to understand are mechanisms and adverse effects. You know, the what and the how. Okay, so the first thing that thiazides do are they're gonna block sodium chloride reabsorption. Okay, and when I mean reabsorption, I'm talking about blood is filtered through the kidney and solutes are reabsorbed into the blood. Okay, that's what I mean by reabsorption. Okay, so easy. Thiazides block sodium chloride transporter. That's it. Transporter. Okay, and so what? But how does that create its intended effects? Okay, so in the DCT, okay, of the kidney, of the DCT, we got a tubule, looks something like this, okay, and here is our sodium chloride transporter. All right, no, circle like this. Okay, so our intended effect is to block this guy. All right, now what is that going to cause? Now sodium is going to travel in greater quantities through the nephron, right? And as always, water follows sodium. So water will leave the plasma and will enter into the nephron and be excreted into the urine. Hence the term diuretic, okay? You're letting go of water. And so the gist here is if you increase the urine, you increase the, if you increase the urine, you're going to decrease the plasma. And that will have its intended effect on lowering blood pressure. And that's it, okay? Now, but as always, when we talk about drugs, we need to know adverse effects. So the first thing that I want you remembering anytime you think about thiazide diuretics is that you're gonna think about hypergluc, just like that. And we're also gonna be thinking about hypokalemia and natremia. Okay, so we'll start with these ones because I think these are the easier ones to understand. So like we were talking about up here, if you increase the amount of sodium that you're excreting, that means you're decreasing the amount that you're reabsorbing. Reabsorb, right? So that's going to lead to the hyponatremia, okay? The hypokalemia one is a little bit more complex, and where in the nephron, we'll get rid of this guy for a second. In the nephron, you blocked your sodium chloride transporter. And now this led to a big increase in the amount of sodium that's now passing through the nephron. Later on in the nephron, you have a sodium potassium transporter, all right? And the sodium potassium transporter is going to sense, or there's going to be such an increase in the amount of sodium that's passing through, it's going to try really hard to absorb all the sodium that it can. But that doesn't come without its consequence. The consequence is every time this guy tries to absorb sodium, he's going to be letting go potassium. Okay, and that's how we get our hypokalemia. Okay, now I didn't tell you what hypergluc meant. That's going to be glycemia, lipidemia, uricemia, and calcemia. What you need to know here is that thiazides increase the reabsorption of calcium. So that's going to be our calcemia. And that's why thiazides are used not only for heart failure, hypertension, but they're also used for hypercalciuria. So if you have too much calcium being let go in the urine, you can give a thiazide, because one of its adverse effects, but in this case it's desired, is that it causes reabsorption of calcium. So that's your hypercalcemia right there, assuming you're already hypocalcemic. All right, so always remember hypergluc. That's gonna help you a lot in questions. You have a patient that's on thiazide and their calcium is super high, or their uric acid levels are really high, and they're experiencing some kind of maybe gout or something like this, and they ask you what's the most likely drug, and they give you a whole bunch of drugs. They ask you what drug is the patient most likely on. You're gonna put thiazides. All right, so again, thiazides block sodium chloride transporter in these more specifically early distal convoluted tubule. That's going to cause an increased amount of sodium being excreted in the urine. Water will follow, and that's going to lead to decreased plasma, decreased blood pressure. That's how we get rid of hypertension. And always for thiazides, hypergluc, glycemia, lipidemia, uricemia, calcemia. Hypokalemia, because remember, the transporter later on in the nephron will try to reabsorb sodium as much as possible, but it won't really do it with the same efficiency. And it's going to let go of potassium as it tries to reabsorb, and that'll decrease the potassium in the plasma. And natremia, because we're no longer reabsorbing sodium. All right, so that's thiazides. If you like this video, thanks.